Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Extended reduced dose Apixaban for cancer-associated venous thromboembolism. Background. In patients with active cancer and venous thromboembolism, whether extended treatment with a reduced dose of an oral anticoagulant is effective in preventing recurrent thromboembolic events and decreasing bleeding is unclear. Conclusions. Extended anticoagulation with reduced dose Apixaban was non-inferior to full dose Apixaban for the prevention of recurrent venous thromboembolism in patients with active cancer. The reduced dose led to a lower incidence of clinically relevant bleeding complications than the full dose. The next article. Endovascular treatment for stroke due to occlusion of medium or distal vessels. Background. Endovascular treatment, EVT, of stroke with large vessel occlusion is known to be safe and effective. The effect of EVT for occlusion of medium or distal vessels is unclear. Conclusions. In persons with stroke with occlusion of medium or distal vessels, EVT did not result in a lower level of disability or a lower incidence of death than best medical treatment alone. The next article. Endovascular treatment of stroke due to medium vessel occlusion. Background. Whether the large effect size of endovascular thrombectomy, EVT, for stroke due to large vessel occlusion applies to stroke due to medium vessel occlusion is unclear. Endovascular treatment for acute ischemic stroke due to medium vessel occlusion within 12 hours did not lead to better outcomes at 90 days than usual care. The next article. Dapagliflozin in patients undergoing transcatheter aortic valve implantation. Background. Sodium glucose cotransporter 2, SGLT2, inhibitors reduce the risk of heart failure admission among high-risk patients. However, most patients with valvular heart disease, including those undergoing transcatheter aortic valve implantation, TAVI, have been excluded from randomized trials (TANSI) conclusions. Among older adults with aortic stenosis undergoing TAVI who are at high risk for heart failure events, Dapagliflozin resulted in a significantly lower incidence of death from any cause or worsening of heart failure than standard care alone. The next article. Assessment of a polygenic risk score in screening for prostate cancer. Background. The incidence of prostate cancer is increasing. Screening with an assay of prostate-specific antigen, PSA, has a high rate for false positive results. Genome-wide association studies have identified common germline variants in persons with prostate cancer, which can be used to calculate a polygenic risk score associated with risk of prostate cancer. Conclusions. In a prostate cancer screening program involving participants in the top decile of risk as determined by a polygenic risk score, the percentage found to have clinically significant disease was higher than the percentage that would have been identified with the use of PSA or MRI. Next, we will be discussing articles from Journal of American Medical Association. Invasive group, a streptococcal infections in 10 U.S. states. Question. What are the recent trends and epidemiological findings in invasive group, a streptococcus, GAS, infections in 10 U.S. states? Findings. In this population-based study of 21,312 patients with invasive GAS infections from 2013 through 2022, overall incidence increased from 3.6 to 8.2 cases per 100,000 persons. Incidence was particularly high among those 65 years or older, American Indian or Alaska Native persons, residents of long-term care facilities, people experiencing homelessness, and people who inject drugs. Non-susceptibility of isolates to macrolides and clindamycin increased substantially, meaning accelerated efforts to prevent and control GAS are needed. Next, we will be discussing articles from Annals of Internal Medicine. Insurer-Level estimates of revenue from differential coding in Medicare Advantage. Background. Medicare Advantage, MA, plans report diagnoses more intensely than providers in the traditional Medicare, TM, program, and there is wide variation in coding intensity across MA plans. Conclusion. Any MA payment policy reform that effectively targets differential coding will have a widely disparate effect across insurers. Next, we will be discussing articles from British Medical Journal. Evolution of reported patient and public involvement over time in randomized controlled trials in major medical journals and in their protocols. Objective 2. Investigate the reporting and evolution of patient and public involvement, PPI, in randomized controlled trials published over time in major medical journals and in their trial protocols. Conclusion. This study found limited PPI reported in randomized controlled trials published in major medical journals and in their respective protocols, underscoring the need for consistent, detailed, and transparent PPI reporting practices in clinical research. Next, we will be discussing articles from Lancet. Effect of digital adherence technologies on treatment outcomes in people with drug-susceptible tuberculosis. 4 pragmatic, cluster randomized trials. Background. The impact of digital adherence technologies on tuberculosis treatment outcomes remains poorly understood. We investigated whether smart pill boxes and medication labels can reduce poor treatment outcomes in patients with tuberculosis. Interpretation. Digital adherence technologies did not reduce poor treatment outcomes in the 4 countries investigated. The use of digital adherence technologies should be based on careful review of additional data on economic evaluation, patient and stakeholder preferences, and the effect on other important patient outcomes beyond programmatic treatment outcomes. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Cancer Journal for Clinicians. Cancer Statistics for African American and Black People, 2025. African American and other Black individuals, referred to as Black people in this article, have a disproportionate cancer burden, including the lowest survival of any racial or ethnic group for most cancers. Every 3 years, the American Cancer Society estimates the number of new cancer cases and deaths for Black people in the United States and compiles the most recent data on cancer incidence, herein through 2021, mortality through 2022, survival, screening, and risk factors using population-based data from the National Cancer Institute and the Centers for Disease Control and Prevention. In 2025, there will be approximately 248,470 new cancer cases and 73,240 cancer deaths among Black people in the United States. Black men have experienced the largest relative decline in cancer mortality from 1991 to 2022 overall, 49%, and in almost every 10-year age group, by as much as 65% to 67% in the group aged 40 to 59 years. This progress largely reflects historical reductions in smoking initiation among Black teens, advances in treatment, and earlier detections for some cancers. Nevertheless, during the most recent 5 years, Black men had 16% higher mortality than white men, despite just 4% higher incidence, and Black women had 10% higher mortality than white women, despite 9% lower incidence. Here are the articles from Journal of Clinical Oncology. Minimal residual disease-based endpoint for accelerated assessment of clinical trials in multiple myeloma. A pooled analysis of individual patient data from multiple randomized trials. Purpose. Newly approved drugs and combinations treating multiple myeloma, have resulted in substantial improvements in patient survival. To deliver rapid access to newer therapies, an earlier endpoint to expedite clinical trials is needed. Our objective was to evaluate the minimal residual disease negative complete response, MRDCR, as an intermediate endpoint for progression-free survival, PFS, and overall survival, OS, in newly diagnosed, ND, transplant-eligible, NDTE, patients, ND transplant-ineligible, NTEEN patients and patients with relapsed/refractory, RR, MM. Conclusion. Our findings provided the support for use of MRD-CR classified at a 10 to 5 threshold, at either 9 or 12 months after starting of the treatment, as an intermediate endpoint to support accelerated approvals in future trials in NDTE patients, NTN patients, and patients with RRMM. Here are the articles from Journal of Hepatology Association of Metabolic Signatures of Air Pollution with MOSLD, Observational and Mendelian Randomization Study. Metabolic signatures of air pollutants were identified by 251 metabolites. Air pollutants, PM2.5, PM10, NO2 and NOx, were associated with risk of MOSLD. Mendelian randomization analysis linked PM2.5, NO2, and NOx-related metabolic signatures to MOSLD. Metabolic signatures mediated the association of PM2.5, PM10, NO2 and NOx with MOSLD. Next we will be discussing articles in the field of gastroenterology. Here are the articles from gastroenterology. Glepaglutide, a long-acting glucagon-like peptide 2 analog, reduces parenteral support in patients with short bowel syndrome, a Phase 3 randomized controlled trial. Background and aims. Glepaglutide is a long-acting glucagon-like peptide, GLP-2 analog developed to improve intestinal absorption in patients with short bowel syndrome, SBS. The authors conducted a trial to establish the efficacy and safety of glepaglutide in reducing parenteral support, PS, needs in patients with SBS with intestinal failure to occlusions. Glepaglutide treatment in patients with SBS with intestinal failure resulted in clinically relevant reductions in PS requirements and was well tolerated. Here are the articles from Clinical Gastroenterology. Histological outcomes of pharmacological interventions in eosinophilic esophagitis for adults and children, a network meta-analysis of randomized controlled trials. Introduction. Multiple pharmacological interventions have been studied for managing eosinophilic esophagitis, O. We performed a comprehensive systematic review and network meta-analysis of all available randomized controlled trials, RCT, to assess the efficacy and safety of these interventions in O in adults and children. Conclusions. Network meta-analysis demonstrates histological efficacy of multiple medications for O. Because of the heterogeneity and large effect size, we recommend more trials comparing pharmacotherapeutic interventions with each other and placebo. An important limitation of this study is absence of clinical efficacy data due to insufficient data. Other limitations include heterogeneity of operator, population, and outcome analysis. Next we will be discussing articles in the field of rheumatology. Safety of avacopan for the treatment of antineutrophil cytoplasmic antibody-associated vasculitis, combined data from 3 clinical trials. Objective. This study aimed to report the safety of avacopan, an oral selective complement C5a receptor antagonist, using pooled data from clinical trials in patients with antineutrophil cytoplasmic antibody, ANCA-associated vasculitis, granulomatosis with polyangiitis, GPA, or microscopic polyangiitis, MPA. In clinical trials of GPA or MPA, use of avacopan was associated with fewer A's, SAEs, and WBC count reductions and fewer infections than non-avacopan treatment. Safety data support the use of avacopan in patients with GPA or MPA. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Age-related differences between juvenile and adult autoimmune inflammatory myopathies. Background. Clinical features and prognosis of autoimmune inflammatory myopathies, AIMs, can vary depending on the age of disease onset. The aim of this study was to compare the demographic characteristics, clinical features, laboratory findings, and long-term prognosis of juvenile and adult AIMs. Conclusions. AIM with different onset ages is associated with distinct clinical manifestations and outcomes. The present study reported that in AIM patients, Lung involvement and malignancy increase with age while clinically inactive disease decreases. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Evidence-based application of natriuretic peptides in the evaluation of chronic heart failure with preserved ejection fraction in the ambulatory outpatient setting. Background. Plasma NT-proBNP, N-terminal pro-B type natriuretic peptide, is commonly used to diagnose heart failure with preserved ejection fraction, FPFE, but its diagnostic performance in the ambulatory/outpatient setting is unknown because previous studies lacked objective reference standards. In patients with chronic unexplained dyspnea, current rule-in and rule-out NT-proBNP diagnostic thresholds lead to unacceptably high error rates, with important interactions by obesity and AF status. In our study, NT-proBNP provided little value in those with AF and dyspnea, because the presence of AF is by itself a robust biomarker of FPEF. Use of separate rule-in and rule-out diagnostic thresholds stratified by BMI reduces miscategorization and can guide more appropriate use of exercise testing for possible FPFE. Here are the articles from Journals of the American College of Cardiology. Cardiac troponins and cardiovascular disease risk prediction. An individual participant data meta-analysis. Background. The extent to which high-sensitivity cardiac troponin can predict cardiovascular disease, CVD, is uncertain. Objectives. We aimed to quantify the potential advantage of adding information on cardiac troponins to conventional risk factors in the prevention of CVD conclusions. Measurement of cardiac troponin results in a modest improvement in the prediction of first-onset CVD that may translate into population health benefits if used at scale. From JAMA Cardiology. Default bulk ordering and text messaging to enhance outreach for lipid screening. A randomized clinical trial. Question: can bulk ordering and text messaging with behavioral insights boost the effectiveness of lipid screening outreach? Findings in this randomized clinical trial with 1,000 participants, patient outreach with bulk ordering resulted in higher lipid screening uptake than usual care. Adding behaviorally informed text messaging did not significantly increase uptake, meaning bulk orders are a low-cost intervention that may both reduce effort for patients and clinicians and increase uptake of lipid screening. Text messaging does not provide significant additional benefit. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. MBX 2109, a once-weekly parathyroid hormone replacement therapy prodrug, Phase 1, first-in-human randomized trial. Context. Hypoparathyroidism denotes parathyroid hormone, PTH, deficiency and impaired mineral metabolism. MBX 2109, a novel prodrug yielding a biologically active PTH peptide agonist, PTH 1-32, extended by a fatty acylated Lys 33, is being developed as a long-acting, once-weekly PTH replacement therapy. Objective. Here, we report the safety, pharmacokinetics, PARC, and pharmacodynamics, PD, of MBX 2109 in healthy volunteers. Conclusion. The sustained-action PTH prodrug MBX 2109 was well tolerated with no unexpected, off-target safety issues. The long half-life and flat exposure profile of MBX 2109's biologically active PTH agonist supports once-weekly administration. MBX 2109 doses were identified for future studies. Here are the articles from Diabetes Care. Diabetes risk after treatment for childhood and young adult cancer. Objective. Diabetes is a potential late consequence of childhood and young adult cancer, CYAC, treatment. Causative treatments associated with diabetes have been identified in retrospective cohort studies, but have not been validated in population-based cohorts. Our aim was to define the extent of diabetes risk and explore contributory factors for its development in survivors of CYAC in the UK. Conclusions. This evaluation of a hospital-based cohort of patients with SIAC identifies these patients' increased long-term risk of developing diabetes, and how this varies temporally according to treatment modalities. Notable contrasts in risk by treatment were detected as early as 10 years after cancer diagnosis. Findings should inform the development of risk-stratified evidence-based screening. Here are the articles from Diabetes Care. Diabetes risk after treatment for childhood and young adult cancer. Objective: diabetes is a potential late consequence of childhood and young adult cancer, CYAC, treatment. Causative treatments associated with diabetes have been identified in retrospective cohort studies, but have not been validated in population-based cohorts. Our aim was to define the extent of diabetes risk and explore contributory factors for its development in survivors of SIAC in the UK. Conclusions. This evaluation of a hospital-based cohort of patients with SIAC identifies these patients' increased long-term risk of developing diabetes, and how this varies temporally according to treatment modalities. Notable contrasts in risk by treatment were detected as early as 10 years after cancer diagnosis. Findings should inform the development of risk-stratified evidence-based screening. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Neurodegeneration and demyelination in the multiple sclerosis spinal cord. Clinical, pathological, and 7T MRI perspectives. Background and objectives. Key findings in people with multiple sclerosis, MS, with progressive motor disability are spinal cord, SC, atrophy, signifying irreversible axonal loss, and SC demyelinated lesions. This study aimed to identify neurodegenerative changes and assess the clinical impact and pathologic characteristics of SC lesions. Discussion. Thresholding 7TT2 post-mortem MRI can effectively discriminate demyelinated lesions which correlate with clinical disability and cord atrophy. T2 hyperintense/myelinated regions exhibit myelin and axonal pathology in paraplaque, or tract-based distribution suggestive of neurodegeneration. Limitations include sampling of 2 cm of SC across participants, making conclusions about proximal and distal pathology difficult. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Estimation of expiratory function in infants with passive expiration from total lung capacity. Background. Evaluating expiratory airway function in infants is challenging because the criterion standard, the raised volume rapid thoracoabdominal compression technique, is technically difficult and has a high failure rate. Research question. Are measurements obtained during passive expiration from total lung capacity correlated with forced expiration measurements obtained by the raised volume technique in infants? Interpretation. Our results indicate that the passive flow volume curve offers reliable and reproducible data with high correlation to the forced flow volume curve. Therefore, the passive flow volume curve may serve as an alternative tool in evaluating expiratory airway function in infants. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Temporal exploration of chronic obstructive pulmonary disease phenotypes, insights from the COP gene and spiromics cohorts. Rationale: chronic obstructive pulmonary disease, COPD, exhibits considerable progression heterogeneity. We hypothesized that elastic principal graph analysis, EPGA, would identify distinct clinical phenotypes and their longitudinal relationships. Objectives. Our primary objective was to create a map of COPD phenotypes and their connectivity using IPGA. Secondarily, we used longitudinal and external data sets to test the validity and reproducibility of this map. Conclusions. This novel analytic methodology provides an approach to defining longitudinal phenotypic trajectories using cross-sectional data. These insights are clinically relevant and could facilitate precision therapy and future trials to modify disease progression. Next, we will be discussing articles in the field of nephrology. Here are the articles from Kidney International Reports. Real-life data of 2-year lumasiran use in the daily Luma cohort. Introduction. Lumasiran is a drug used in RNA interference (RNAi) therapy for primary hyperoxaluria type 1, PH1. Data on its efficacy and safety mainly come from industry-sponsored trials. Conclusion. Daily Luma is the largest cohort of patients receiving lumasiran in real life, confirming its safety and efficacy at 2 years. Next article. Systematic review of the effects of iron on cardiovascular, kidney, and safety outcomes in patients with CKD. Introduction. Heart failure and chronic kidney disease, CKD, are closely associated, and iron deficiency is highly prevalent in both conditions. However, major cardiovascular and nephrology guidelines offer contrasting recommendations for iron use. We evaluated the effects of iron versus usual care or placebo on the clinical outcomes in patients with CKD. Conclusion. Iron therapy may reduce the risk of heart failure and cardiovascular death in patients with CKD. Randomized trials evaluating the effects of iron on clinical outcomes are needed, especially in non-dialysis patients with CKD with or without anemia.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.